a patient with CVD is prescribed Gaviscon. What's in Gaviscon, guys?
Sodium alginate.
Yeah, what is sodium alginate?
It floats to the top of the...
What else has it got in it?
Magnesium.
Yeah, so it's got
aluminum.
salts which bind to acids which neutralize it in the stomach. What formulation is better? Tablet form Gaviscon or liquid form?
Liquid
Yeah,
form.
why is that?
Because it's easier to be solubilized,
Exactly.
you know, like it's easier.
Because it only works in a solubilized form. If you're taking tablets, you're just chewing it up and making liquid Gaviscon in your mouth. You'll still get lumps in it, so it's better to have the liquid. So 10 ml QDS. What's OD? What's OD? What's
Once
BD?
day.
What's
Twice a day.
TD?
3 times.
QD.
Yeah.
What's 5 times a day? I don't know.
I don't have only ever seen it written.
I've never either. But you do take one medicine 5 times a day. One very popular one.
Savara.
Yeah, very good. It's cyclovir. 5 times a day.
Shingles.
What do you think 5 times a day is, from your in-depth knowledge of Latin?
Penta.
Pent.
Penta,
Something P, isn't it?
P.
So it's probably PDS, I reckon. 5.
Yeah.
Even Wikipedia doesn't know. Come on, Wikipedia. All right, let's leave that alone. Who cares? Doesn't matter. Never see it. So where did we get to? The prescriber asked the pharmacist how many millimoles of sodium ions the patient is taking from this in 24 hours. Which of the following is correct? This is quite an easy question. Claire, do you know the reference of this?
How do you mean?
How do you know how many millimoles of sodium ions in something?
The molecular weight.
No.
The sodium.
When you see this question, what's the first thing that goes through your mind?
Well, first of all, what's taken in 24 hours?
Yeah. So 10 mils QDS, so it's 40. Oh, and 20 mils. So it's 40 mils plus, so it's 60 mils. 60 mils a day. So once you know that, then what do you need to do?
How many millimoles in that much?
So how do you get that?
So you'll have to go to the BNF and check what's the concentration of sodium. It says contains 3.1 millimoles of sodium per ml.
3.1 millimoles per what, Merlin?
Per 5 ml.
5 mil. So 5 mil. 3.1.
3.1, yeah.
Okay. So what's that times? You've got to times it by 12, yeah?
Yeah. Yeah, to make it 60.
So it's about 36, isn't it?
Yeah, it's about 36. Let me just 60 times 3.1 divided by 12.
Yeah, it's 36 millimoles.
Yeah.
That's super easy. Okay, next one. Adult patient has been prescribed benorelate, whatever that is, suspension 5 ml 3 times a day for rheumatic pain. If needed, how many paracetamol tablets BP may be taken in addition each day without exceeding the normal daily recommended dose of paracetamol? So from that, you can kind of gather, because there's quite a few combination preparations of paracetamol and something else. It could be, I don't know, paracetamol and codeine, maybe? Paracetamol and aspirin? How much paracetamol can you take in a day?
Normally 8.
Yeah.
2.5 grams.
Yeah. No, 4 grams, Merlin.
Oh, is it
4
4
grams
grams?
in a
Sorry,
day.
yeah. Okay. 4 grams. Phenoloate. I can't find that in the new BNM.
I think it might have been removed. This looks like an old question. But benorelate has 2 grams in 5 ml paracetamol.
Okay.
2 grams in 5 ml. And they're taking 15 ml.
15 ml.
So it's 3 doses, which is equivalent to about 6 tablets.
Yeah, 6 grams.
So out of that, you can probably take 2. So the answer is D. Okay, let's do this one. Let's do this one, number 6.
Okay.
Okay, the required dose of aminophylline by IV infusion is 1 mg per kg per hour for children aged between 6 months and 9 years. 6 months and 9 years, okay. Calculate the rate at which the infusion should be set for a 3-year-old child of average weight. Aminophylline injection is available on the ward.
So for a 3-year-old child, the weight is 14 kilos.
Okay.
14 kilos. So it's 14 mg per hour.
Do you guys want to work it out and just give me an answer at the end of it? Okay, guys, remember you've only got 2 minutes to do these questions, and this one's quite straightforward, so I wouldn't...
Oh, yeah, sorry, I was trying to see what the options were. So I have it that they would have 1.79 mils. So if they're if it's 25
mg in a mil.
In a mil,
Yeah.
okay, so 14 mgs, because the patient is going to need 14 mgs if it's a 1 mg per kilo, and the patient is 14 kilos.
Yeah.
So they will need 1 mg, sorry, they'll need 14 mgs per hour. So they're going to need the 1.79 mils of that. Oh, no, hang on.
Oh, I think I see what you're doing. No, but you're after a rate. You're not after a volume.
Are you given... Oh, no, you don't need to know the
No.
the needle width or anything like that on that one.
No. It's very straightforward, this one. So if the child is, let's say, 14 kilograms,
Yeah.
and it's 1 mg per kg per hour, all you do is do 14 kilograms divided by 25 mgs per mil.
0.56.
And it's 0.6. Well, not, yeah, round about 0.6. So the answer is going to be C.
0.6 ml. C, yeah.
Calculate the rate at which the infusion should be set for a 3-year-old child. So you figured out the weight, which is in the back of the BNF. Then you've just multiplied it by 1. So then you just divide by the rate. So 14 over 25 is around about 0.6. Let's go back to this one.
So just if you multiply it by 10,000, you get parts per million.
I find these really... Do you find these quite easy, these ones?
Yeah, these ones are alright.
Yeah.
Since you told them.
They don't seem that difficult.
No. I think these are all concentration questions.
Yeah.
Trying to get the right concentration.
Half-life. Patients admitted to hospital following an overdose of something. The drug's half-life is 8.5 hours. A toxic plasma concentration of 52 micrograms per mil is measured. How long in hours will it take for the plasma concentration to fall to 3.25 microgram per mil?
Is there a a formula to put the stuff in for half-life? Do you know?
Yeah, but you don't get that in the exam.
Oh, okay. A drug's half-life is 8.5 hours. I wonder if there was like an easy way to find these.
There isn't. I tend to draw it.
Oh.
So, where is it? So it would just be like, you're starting at 52, yeah? So that's at T0, 26 at T1, what can I think, 13 at T2, 6.5 at T3, 3.25 at T4. What's that in half? It is 1.625 at T5. So how long? So we've got to get to this. So this is that. So T4 equals 4 times 8.5, which equals 34. Yeah?
Okay. Okay.
There's probably an easier way, but
this is easy enough.
Yeah, it's kind of,
as long as you can draw it.
Kind of foolproof, isn't it?
How do we work that out?
Well, I wouldn't know how to work this out. Well, you can work it out exactly, but you can rule certain things out. As you said, you need 2 tablets, yeah?
Yeah.
So this option's wrong.
Yeah.
So you know that that's definitely wrong. You need to have a minimum of 200 milligrams times 10. So you need to have a minimum of 2 grams, yeah? So you know that this one's wrong.
Yeah.
Okay? So you know this one's wrong and you know this one's wrong.
Yeah.
It also can't be this one because this is going to be 60 grams, which is above that within the excipient. So if you think about the proportions, it's not possible. So the only 2 options that you can have is either this one or this one. And the way that you would work it out is 2 tablets is going to be 60 milligrams in 2,000 milligrams. No, in 2,400 milligrams. So you work out the proportion. So 60 milligrams in 3,000 milligrams. So what are these as percentages? Well, 60 divided by 2,400 is 0.025. This one is 60 divided by 3,000 is 0.02. The percentage needs to be the same as the percentage of this. So 50 divided by 2,000 equals 0.25. So this is the right answer.
Oh, okay.
Do you understand that though, Merlin?
Oh, yeah.
Yeah. So as we said, so it can't be this one because this is, think of the proportions. So you're trying to get this proportion. So this would be 60 milligrams in that.
Okay, I understand.
This would be 2 times, so 60 in 2,000. This one would be 60 in 2,400. This one would be 60 in 3,000. This one would be 30 in 2,400.
In
So it's all about the proportions. So it definitely can't be this one. So 30 divided by 2 equals 0.0125. 60. So the main thing is getting to this proportion. So 50 in 2000 is 0.025. Yeah. Okay.
That was clever.
Yeah. So looking at the proportions, that's probably the best way to deal with that.
Okay.
Which one of the following is usual dose of salbutamol recommended for one child, his age, weight? Yeah. So that's a direct BNF reference question. It's pretty easy. Strong should be added. Yeah. Do you want to do that one?
Yeah.
Yeah, I'm going to go make a cup of tea.
I'm stuck.
You're stuck. What are you stuck on?
I know that 0.9, so the concentration of the infusion is 0.9%.
Yeah.
So that means 0.9 grams and 100 ml.
Yeah.
And then in 500 ml, we have 4.5 grams.
Yeah, because you're multiplying
Yeah.
it.
Yeah, you multiply it by 5. Then it's the millimoles. You know when the millimoles come in, how to convert it?
Yeah. So mass over MR.
Oh yeah, moles equals mass over. Mass over MR. But you do need to know the MR of potassium chloride then.
You do, which isn't written there.
Yeah.
I'll get it for you.
When in the exam, you'll have to work it out.
No.
Yourself.
They'll give it to you.
Oh, yeah, okay, fine. So moles. Okay.
It is 75.
75. Yeah. So it's 4.5 grams. So 4.5 divided by 75. So 500 ml to 1000, you just times it by 2. So then it would be 0.06 millimoles.
Very good.
Yeah, I think so. Where is it? Yeah.
Yeah. Well, good. That was a bit tricky, that one.
Yeah, that is quite tricky.
Chloride.
So the answer is?
It's A.
A.
Yeah. Merlin, this one. This should take you 20 seconds.
Don't do to hospitalize it. So you have to look it up.
Yeah. Don't bother, as long as you know where it is.
Okay. It's in the front, isn't it? Morphine and diamorphine.
Yeah.
Yeah, okay.
This one should take you about a minute.
A tablet contains the following ingredient: chlorphenamine, 4 milligram. How much lactose is required to make 10,000 tablets? Okay, so how much of lactose? So, okay, you just have to 4 milligram plus 20, so that is 24 milligram. So 40 minus 24, you get 6, and then 16 milligrams of lactose in one tablet. So to make it into 10,000, so you just times it by 10,000 milligrams, isn't
milligrams,
it?
Yeah.
So yeah, so it would be 1 unit 10. Yeah. So that would be a gram. 160 grams I'm getting. So that's 0.16 kilograms.
Yeah, D. Very good. That was good. That took you about 40 seconds. Omeprazole suspension admitted if the pediatric dose regimen is 2.5 milligrams 10 times a day. Patient's weight, material suspension because one.
That's easy.
Yeah. Don't bother with that one.
Okay.
This one you know straight up. Diamorphin, easy. Syringe driver. Let's see this one. The syringe driver is set to 20. What's a syringe driver?
Is it when it gradually, or it has a rate set and it will deliver that much amount of the drug in that time? Yeah.
So when the one thing I remember about syringe drivers is a friend of mine broke his leg playing football, ended up in hospital, and they gave him morphine in a syringe driver, and they gave him a button to self-administer, and he just sat there pressing the button all day, and he had like a really good time. But basically, it's like it's a syringe with a little motor in it, and it just pushes it in. So this syringe is actually, it's got 20 mils of 1 milligram, sorry, 1 gram in 400,000 mil solution over 3 hours. How many milligrams will the patient receive overall? It's easy.
Over 3 hours, how many milligrams? So you just have to cross multiply.
Yeah, it's cross multiply. So all you're doing is 1 gram in 4.
1 gram is 1,000 milligrams. No?
Yeah.
1,000 milligrams. So 1,000 times 20 divided by 400,000.
Exactly. So yeah, you can do that. The only way in the exam, though, what they can do. So wait, what's the answer to this anyway?
So 1 divided by 20, which is not 5.
Gram.
Grams, yeah.
Okay, so tell me how much is delivered in an hour and a half.
How much is delivered in an hour and a half? It will be half of that, not 2.
Good. So you're just doing kind of proportions.
Yeah.
Good. Okay. Next one. In respect to betamethasone, following preparations, how many betamethasone RD do you require to have the same amount of betamethasone in 1 pack of 30 gram?
In respect to betamethasone containing how many?
Do you know what RD stands for?
RD, no.
Reduced dose.
Oh. So, thank you. So what does reduced dose mean? Is it like MR?
No, it just means there's a smaller concentration.
Okay, of betamethasone.
Yeah.
You know the question above. So that is 0.05. Isn't it 0.05 milligram the answer?
Hold on. 16.
16. D.
This is the answer I got for it.
D.
Oh no, you got it.
Okay.
Yeah, no, it's D. You got a 1
milligram.
0.
So it was just the mg. Yeah, that's fine. Just thinking. And the time stated.
Yeah. It's easy.
That's fine. For that betamethasone, you'll have to look it up in the BNF.
Yeah, it's good to know though that I know this off by heart. I don't know why. RD is usually 4 times less. So the answer is C. You need 4 times as much. Okay, so ferrous conversion. You know where that is. 10-year-old stung by a bee, anaphylaxis, ambulance. What dose? So what dose would you give a 10-year-old child?
So you'll have to look it up in the BNF.
Yeah, it's good to know this. You'll probably learn this actually. So if you're 12 and above, it's 500 micrograms. If you're between 6 and 12 years old, it is 300 micrograms. If you're below 6, it is 150 micrograms. Yeah?
Okay.
Okay, I've got a question for you. What's the answer?
A.
No.
You said that between 6 and 12, it is 300 micrograms.
The child is 7 years of age, yeah?
Yeah.
So, according to this line, you need to give how much?
Yeah, 300 micrograms.
Yeah. What volume is 300 micrograms of this?
It's 0.3 ml.
Very good. But you have a pre-filled syringe, which is 1 ml.
So 1 minus 0.3 ml.
Very good.
Okay, 0.7 ml. So it's actually reading the question because you're asking how much waste is asked. Okay.
That's tricky.
You put that in and you just add it in. It's a good question.
Yeah.
That's good. I got 1,600. No idea.
Drops. That's like a swimming pool. That's an ocean. It's not right.
Why did I get that?
Come on, this is pretty straightforward.
Okay, what is the drop rate per minute?
What is the drop rate per minute?
Oh, that's why. So what I worked out is per hour.
Okay.
So
divide by 60.
Divided by 60 to get the answer. 2 times 3, 2 times 80. 80 divided by 3. 3 into 2 is 6.
Sounds right.
2.6 something. Wait. 80, 26. So it's 26 drops. Is it? Yeah, 26 drops per minute.
Which answer?
26.6. 27 drops.
Yeah,
B.
because you need a bit more.
Yeah.
So this is what the answer came. Visit pharmacycpa.com for the full video series. As always, for more information, please subscribe to our YouTube channel, join our free PCPA course, join our Facebook group, or subscribe to our blog.